For those around the table, which there are not many, please turn on your microphones when speaking. For those participating via Zoom, please state your name when making a comment or asking a question. The MAG public comment process allows members of the public to comment on items that fall under MAG's jurisdiction. If you would like to comment at today's meeting, please complete the request to speak form. MAG staff can assist with any questions you may have. If you parked in the garage, a validation stamp is available on the counter. If you purchased a transit ticket to come to the meeting, please see staff for a ticket. Hearing assisted devices are available from MAG staff. We will now begin the meeting with a roll call of all members.
Thank you, Chair. Members of the Active Transportation Committee, I will do roll call in order of member agency. Sydney Urias, Elaine Mariel, Tiffany Halperin, Ward Stanford, Anissa Gerard. Here. Thank you. Hezekiah Rocha.
Here.
Thank you. Earl Ratledge.
Here.
Jose Macias.
Here.
Andy Smith.
Present.
Justin Weldy.
Present.
Stephanie Bubenheim.
Here.
Wayne Smith. Randy Proch. Reed Kempton.
Yeah. Here.
Thank you. Garrett Topham.
Here.
Amy Rebinar. John Beltrain.
Here.
Les Johnson.
Here.
Susan Conclu.
Here.
Hip Terrazas, proxy for Stephen Chang.
Here.
Thank you. Chase Wallman.
Here.
Gabriel Elias.
Here.
Marty Zeke.
Present.
Grant Anderson.
Here.
Thank you. And Kara Nasser.
Hi, Kay, present.
Thank you. And Chair Sage.
Present.
Thank you, Chair. We have a quorum.
Thank you, Kay. Our next item is the call to the audience. This is an opportunity for the public to comment on items that fall under MAG's jurisdiction. Didn't I already do this? Pardon me.
You did.
Okay. Item number 3. This item is on the agenda for information. Oh, pardon me. Item number 3 is a MAG staff report. This item is on the agenda for information and will be presented by Kay Bork, MAG Principal Planner.
Thank you, Chair. Members of Active Transportation Committee, I have a few updates. I'd like to update you on the Chair and Vice Chair positions for the committee. Chair position was filled by Patrick Sage. He's assumed the chair position after Mariel Brown from the City of Phoenix resigned her position with the city, as well as her position as chair of the Active Transportation Committee. Also, the vice chair position has been filled. In September, MAG initiated a recruitment for the position, requesting letters of interest. On November 17th, the Regional Council Executive Committee approved the appointment of Stephanie Bubenheim as vice chair, and she will begin her term as of January 1, 2026. Congratulations. Thank you very much. I'd like to welcome 2 new members, Sydney Urias, Deputy Development Services Manager from the City of Apache Junction, as well as Kara Nasser, a Planner 3 with the City of Phoenix. And welcome. Thank you. The Active Transportation Committee meeting schedule, I have a few updates on that. Right now, MAG is preparing the 2026 Active Transportation Committee meeting schedule. And based on the frequency of meetings over the last couple of years, MAG will hold the Active Transportation Committee meetings on a bi-monthly basis starting in 2026. And of course, we'll have the ability to add special meetings if they're needed. We're working on a schedule to complete a full agenda for at least the next 6 months. And we are encouraging in-person participation for those meetings. And next, an update on the Rio Reimagined Active Transportation Plan. We're nearing the end of the Phase 1 public involvement, as well as documenting existing conditions. We met with all the member agency stakeholders in the study boundary, as well as the Rio Reimagined Partnership for several focus group discussions. We've held several public engagement events and to gather feedback, and also advertise an interactive map and survey that was online. Gathered a lot of feedback through that, as well as completing the mapping. So all of this will be wrapping up about in January. Next steps will be evaluating the proposed river alignment and connectivity. So I encourage you, if you want some updates, to check the project website on the MEG website. We'll be posting updates and technical memos as they're available. Later today, I'll be providing an update on the MEG Regional Active Transportation Plan. And then I also wanted to circle back on the design assistance evaluation update. Justice Bruman, the MEG project manager, is scheduled to come back to the Active Transportation Committee in March to present the findings of that evaluation. That concludes my update. Thank you.
Thank you, Kay. Members of the commission, I was incorrect. I would like to back up and do the call to the audience, which I skipped. So please forgive me. It's a new position for me here, new role. So if we can if we can address the call to the audience, which is agenda item 2. This is an opportunity for the public to comment on items that fall under MAG's jurisdiction that are not on the agenda, informational items or items on the agenda for discussion and not for action. 15 minutes will be provided for the call to the audience unless the chair requests an exception to this limit, which I do not. I have not received any request to speak for the call to the audience. Okay. MAG also provides the opportunity for members of the public to submit written comments via the MAG website. Any comments received 2 hours prior to the meeting have been shared with committee members in advance of the meeting for consideration and will be included in the formal meeting minutes. Okay, do we have we received any online written comments for the call to the audience?
Thank you, Chair. We have received no written comments for the call to the audience, and they have been provided, the report has been provided to the members in advance of the meeting.
Thank you. Okay, we'll move on to item number 3, which is the MAG staff report, which we've already done. So now we can get back on track with agenda item number 4. That is the approval of the meeting minutes from the June 17th, 2025 Active Transportation Committee meeting. Does any member of the committee have questions on the minutes from that meeting? Seeing and hearing none. Prior to the approval of the meeting minutes, there is an opportunity for members of the public to comment. I have not received any requests for this item.
I can confirm there have been no requests.
Okay, thank you, Kay. Okay, we'll move on to the approval. Is there a motion to approve the minutes from the last meeting?
So moved.
That was just, pardon for the interruption. Justin, was that you who made the motion to approve?
Correct. Justin from Fountain Hills.
Thank you.
Okay, we have a motion from Justin from Fountain Hills. Do we have a second?
This is Reed Kempton. I'll second.
Thank you, Mr. Kempton. We have a second. We will have those participating in the meeting online take part in a voice vote by turning on their cameras and unmuting their audio. We need to see the faces of everyone to participate in the voice vote. For those who cannot or do not want to turn on their cameras, staff will conduct a roll call vote. Staff will only call on those virtual participants who did not turn on their camera. Members, please leave your cameras on until after the roll call vote so staff can count the people's names whose cameras are not on. Can I have a voice vote of those in the room and those online? Those in favor say aye.
Aye.
Those opposed, nay. Members, please leave your cameras on. Staff, can you take a roll call of the members participating virtually who did not turn their cameras on?
Thank you, Chair. Hip Terrazas, how do you vote?
Abstain.
Thank you. Chair,
You're welcome.
the motion passes.
Thank you. We will proceed to agenda item number 5. This item is a presentation on the agenda for information and discussion and will be presented by Dr. Stephen Gerke from the Northern Arizona University. Is Stephen with us?
I am. Thank you. Remotely.
Hi, Stephen.
How's it going? Thanks, Kay, for the invitation to speak to the committee. It's an honor, and I'll spend a little time discussing. I think I have the opportunity to share my screen, so let me just make sure that I'm able to share my presentation. Are folks seeing that?
Yeah, we can see it here. Thank you.
Okay, perfect.
Yes, I see it remotely. This is Garrett from Mesa.
Okay, perfect. Yeah, just let me know. Sure that you see the PowerPoint slide. So great. Yes, I can dive. Let's see here. Sorry, get my screen set up on my side as well. Okay. Yeah. So thanks for the opportunity to speak to some research that was conducted at NAU. It was as part of a U.S. Department of Transportation grant that we have since completed that was awarded to our team as part of the Region 9 University Transportation Center that NAU belongs to. This research produced a number of 2 different manuscripts. I'm going to present on one entitled Cyclist Involved Crashes and Level of Traffic Stress Evidence from Arizona. Okay, so just some context on this, and I know I'm speaking to the right committee already, but we know cycling provides these co-benefits that go beyond just a mode of transportation that gets us from point A to point B, right? There's co-benefits related to the alleviation of traffic congestion, perhaps positive environmental outcomes, also gained public health benefits as well through physical activity. And so for these reasons and other myriad reasons, cities have sought to promote cycling as a sustainable travel substitute for personal cars. However, cycling in most American cities remains a relatively small mode share, right? I think in Arizona, not to my knowledge, there's no cities that go above 5%, right, of folks that ride their bikes to work or school. And so the question is, how do we motivate this, right? Is the question your committee deals with in the work that they do in their independent jurisdictions. But ultimately what we find is that there's a challenge to alleviate objective safety concerns and also perceived safety barriers to promote wider bicycling adoption. Here are some numbers, traffic safety facts. Folks can see them there, but just kind of give you a sense, that there's a lot of crashes historically that have been large share of urban crashes that involve non-occupants, so pedestrians, cyclists, and then what we see in these figures here, I don't know if there's more current ones, these are up to 23, but we see there's an uptick in cyclist involved crashes in which the cyclist is either killed or injured, right? And so this is a public health crisis. And so one solution that we see, right, and we speak to a lot, is to increase the provision of safer bike facilities and provide more attractive bike routes. The idea of that is by providing off-street separated bike facilities, providing traffic calming techniques, multi-use paths, all these different tools that are in the planner's toolkit. We can expand bike-friendly infrastructure and help alleviate safety concerns and ultimately attract new bicyclists, right? So we can uptick those mode shares. And so that's the overview of this work. Just kind of give you a little bit more background. And so you're kind of situated from when I provide the methodology and results. we looked into using, we adopted a certain typology for cyclists, understanding that cyclists have various physical abilities and perceptions regarding traffic safety conditions. And the typology that we adopted is from Roger Geller. I'm sure many in the audience are familiar with this, but Roger Geller's 4 types of cyclists, Roger Geller being a senior bicycle planner in the city of Portland, Oregon for some time now. And so his typology says there's 3 types of cyclists, right? There's the strong and fearless type. They're out there, they're maybe wearing Lycra, they're taking the lane, right? They're pretty confident in getting around with limited bike infrastructure. But they're a relatively small share of cyclists that we see out on the roadways. More often we see enthused and confident cyclists. So these are folks who are comfortable riding on some roadways as bicyclists, but prefer facilities that are separated from vehicular traffic. And then we have, a larger share of our population, which can be categorized as interested but concerned. And these are folks that would like to ride, but have safety concerns that dissuade them from doing so in traffic, right? Largely safety concerns around riding with shared lanes with vehicle traffic. And then there's another portion of our population that I won't get into, but it's kind of the no way, no how. And these are folks that we try as we may not be able to get them to ride their bikes, right? So we adopted this typology within our study, and then we combined it with the level of traffic stress methodology that's produced by Peter Firth, who's a professor at Northeastern University back in Boston, where I was prior to coming to NAU. And this matches the different types of cyclists with different roadway infrastructure, and it combines attributes of the number of travel lanes that we find on a roadway segment, what's the traffic volumes, the daily traffic, and then what's the posted traffic speeds on there as well, right? And so it takes those different considerations and comes up with this spectrum of level of traffic stress, where a level of traffic stress 1 is about as safe as it can be, right? These are low traffic stress facilities suitable for all cyclists, including children. And then it works its way up, and it can kind of correspond these levels of traffic stress with those cyclist types, right? And so if you get up to levels of traffic stress 3 and 4, they're going to be a little bit more a little less safe conditions, maybe not too attractive to most folks who want to ride their bikes. Okay. So important to understand these typologies as we go forward in describing the study. The objectives here. So overall, with this research that I'm giving you an overview of, is to offer a robust examination of how perceived bikeless security, so using that level of traffic stress metric, relates to observed bikeless safety, so observed crashes, right? Police reported crashes in urban areas. The study area was using, at the time, the most current MPOs we had within the state of Arizona, so including MAG, but also including MetroPlan where I'm at, and the other PAG and the other MPOs as the study area. So we're not looking at rural cycling outside of Metropolitan Planning Organization boundaries. The study objectives are twofold. The first was to look at segment level of traffic stress. I think this is a notable limitation of this work, is that level of traffic stress to date applies to segments and not intersections, right? And so we're looking at segment level of traffic stress designations as predictors of bicyclist motorist crash frequencies, and then bicyclist injury severity in those incidents. And then a second study objective was to look at the significance of LTS as a composite measure with these different traffic safety outcomes, but then also looking at it, the individual components that make up LTS, to see what is it that sort of moves the dial in terms of understanding the connection between perceived safety and objective safety. Data sources, so just give you an idea of what we used to investigate here. And so the bike network we used, different than maybe what many of you use in your agencies. So we used OpenStreetMaps, OSM was our baseline bike network. And so that provides us crowdsourced information. It's user inputted, but it's fairly reliable, and it provides us good information on travel lanes and posted speed limits with some imputation needed where we have gaps in the data. And so that covers most roadway segments within the 8 MPO regions. I know we're not 9 now, but this was 8 at the time of the study. And so just about 150,000 different segments in those urban areas that we looked at. We didn't have ADT traffic volumes, right? So we got that information from ADOT and then used sort of an imputation process to apply that to all segments as well. So then we had the 3 different components of LTS to categorize which of the 4 levels each network segment was in the state's network. We also used NACTO's, the National Association of City Transportation Officials, previous bike facility designations. It's not necessarily outdated, but we did use the manual that was prior to the one that just came out this past year. And so we looked at applying a methodology to label the OSM network with these different bike facilities. We had bicycle boulevards, right, or neighborhood greenways, those areas where you see a little bit of additional bike treatments, but mostly it's just local streets that have painted sharrows, right? Some wayfinding, some designation on them. Conventional bike lanes, right, what we typically see in urban areas where you have maybe a shoulder of a roadway that has line markings, maybe also has the cyclist and an arrow within there. Buffered bike lanes, right? So we're progressively getting perhaps a little bit more safer. You have a little bit of a buffer between the motor vehicle travel lane and the bike lane itself. And maybe there's some separation as well with candlesticks or flex posts in between the two motorway users. Not common in Arizona, but this study also, we've looked in other places, but other unconventional or less conventional bike lanes, so like a left-sided bike lane, right? We also looked at identifying, and then cycle tracks, right? So those facilities that are along roadways, but completely separated from motor vehicle traffic, right? So we identified those facilities in the bike network. And then in looking at crashes, we got information provided by ADOT spanning from 2015 to 2021. ADOT, if you've worked with their crash data, they provide files at an incident level, a unit level, and a person level. So we collected all that information and filtered it out to segment level motorist bicyclist crashes, about 2,300, again, at the segment level, not the intersection level. And then we were also, with that information, able to classify the injury severity of the cyclist involved in that crash, right? Was it a fatality or incapacitating injury, right? And so we put those as being severe versus other injury outcomes and had those labeled as non-severe. So that was the data sources we used. The analytic design, just get a sense of how we went about answering those study objectives. So we first looked at bicyclist crash frequency, right? So the number of crashes occurring on those roadway segments. Not gonna get too much into the regression modeling jargon of it all, but we estimate a pair of negative binomial regression models. It's count data, it's the number of crashes. So that's the proper method to use there. And we looked at what's the impact of LTS category on observed crash frequencies on a segment, and then also those individual components. So again, travel lanes, posted speed limits, traffic volumes. A note on interpretation, a positive model coefficient. So that would signify that the variable, and I'll show you some results real quickly here, but a variable that has a positive association with increased bike crash frequency. And so note on interpretation. The other outcome we looked at, mentioned in study objectives, was bicyclist injury severity. And so here we looked at, it's a binary outcome. So whether it was a severe injury or a non-severe injury. And so we estimated that, again, looking at the effect of LTS category of the segment, LTS 1, 2, 3, and 4. And then also its individual components, as well as we had some information, right, on injury severity about the bicyclists themselves. So what was their age and sex within the police report. And then also some site features. So those bike facilities from NACTO, lighting conditions, roadway grade, some of those finer contextual measures. And again, positive association between the variable and the outcome is sort of a positive relationship. So I'll talk through that as I go through the results. Okay, before I dive into the model results, just give you a quick overview of the descriptive statistics of it to give you just some unadjusted association. So here, I know it's really hard to see, but just kind of as a visualization, we have the 8 different MPOs that were used in the study, and then their LTS network within there. And so that's available if folks are curious. We have that as a shapefile that we could share with folks as well. And then here's the descriptive statistics. So the middle category, I'm not sure if you see my pointer, but it's sort of non-severe injury, so frequent %. And then the far right category is injury severity, or severe injury, either a fatality or a major injury. And so just kind of looking at those associations. So an LTS4, so the most stressful designation of a roadway link, we not surprisingly find that it has the most amount of crashes, right? And so both non-severe and severe. So it's highlighted in that orange shade. Most crashes, whether they be severe or non-severe, also occur on facilities that don't have any bike treatment on them as well, right? And so an association that we look at a little bit more in the modeling, but one that maybe isn't as surprising as well. Looking at individual characteristics of the cyclists, male cyclists tend to be more involved in both non-severe and severe injury-related crashes. A relation to maybe just the split amongst the sexes in terms of bicycle adoption, but then also maybe riskier cycling behavior by male cyclists. And then the last characteristic, I'm barely kind of squeezed in that category of 16 to 44, and that's where we see a lot of cyclists, and that's also where we see a lot of crashes occurring, right, as individuals within that age demographic. Okay, so sorry, flip through there. So looking at the model outcomes, I'll just walk through these pretty quickly, but bicyclist crash frequency. And so here is just looking at the LTS2 category, or LTS categories. You see kind of a progression that beta, that first column, goes up as you get higher in stress volumes. So just showing a positive relationship between traffic stress and crash frequencies. And then when we start to look at the individual components, posted speed limit's a little lumpy. It's not so clear, but we do see that as you get above 35 miles per hour, there's going to be more likely to have crash frequencies occurring. Traffic volume also starts to go up too. So just more cars, more interaction potentially with cyclists. So that has a positive relationship with crash frequency on a roadway segment. The other outcome we had was injury severity. So the model outcomes, again, just looking at the LTS portion of it, the paper I could share with folks has some of the more specific details within it. LTS category is positively associated, but it's a different sort of direction in its relationship. So we actually see that LTS2, so that one that's just above the lowest threshold, is actually has crashes that are most severe in comparison to LTS1. That could be just there's a couple of thoughts that go into there, but some of that could just be based upon, where cyclists are, what facility cyclists are actually using, right? Posted speed limits, we look at the individual components, doesn't matter as much. Obviously, if you get a real high speed, we see real increased severity, whether fatality or incapacitating injuries. And then traffic volume and travel lanes, we see less detection there as well, right? And so that could be because on streets with lower traffic volumes, you see faster travel speeds, and that's going to be a danger potentially to cyclists when there's conflicting points or areas. So those are the modeling results. Didn't go through them in a lot of detail. I'll give you an overview of them. So what does our study find? What are its contributions? Foremost, increased cyclist discomfort for riding on network links is associated with more bike-involved crashes. So there's a lot of ways we can take this, but one suggestion we have is agencies continue just to explore opportunities to improve cycling access to low stress bike facilities, right? To build out their bike networks, to have these LTS1, LTS2 facilities provided for cyclists. That'll help also increase mode adoption by those folks who are interested but concerned, right? Bicyclists also more likely to be severely injured or killed in crashes with motorists along higher stress links. And so just the continued promotion of site level interventions, right? Putting those safe bike infrastructure facilities when you have a roadway that is an important connector, and there's no other sort of alternate facility for cyclists, just ensuring that you have separation, right, from motor vehicles to provide that protection to cyclists. Limitations, research opportunities, mentioned a couple of times. We're looking at link level connections here. We don't have information on bicyclist volumes. It's really hard to get that data, as you all know, probably. But we know that exposure matters, right? And so we had that information. We could probably get a little bit more nuanced findings. And then an important part that my research team is now working on too is we're developing an intersection-specific level of traffic stress measure, right? We know a lot of crashes, most crashes happen at intersections, not necessarily on segments. And so we want to be able to explore that relationship between perceived stress, safety, and objective safety. So that's my presentation. Thank you. I know I kind of blazed through it, but if we have any time for questions, I'm happy to take them. There's my email address too, if you'd like to kind of send me follow-up questions. The QR code in the corner takes you to a cyclist routing engine that my research team's developed that was part of this larger study. And so I encourage you, if you have time, to kind of look at that. It's kind of Google Maps, but for cyclists. So I will stop sharing. And thank you all for listening.
I have a question.
Thank you, Dr. Gerke. We'll now open the floor up for questions. I do believe Commission.
This is Tiffany Halprin. Are you able to hear me?
I can, yes, if you can hear me.
On one of your slides that talked about the number of crashes on the different LTS levels and also on a street that just doesn't have any bike path at all.
Right.
LTS 4 had almost the exact same number of crashes. I think it was off by 3 of the streets that just don't have any bicycle infrastructure. Was I understanding that correct? That's my first question.
Oh, in terms of, yeah, I can maybe open that up to see if I can talk through it with you. But so yeah,
Yes.
it's just you're able to see, yeah,
So,
exactly. So the bicycle facility, none, and the same as LTS 4.
Yes. So yeah, it was like 218 and 215. So
Yep.
it's like 3 crashes different. Do you think that informs, maybe those designations of LTS 4? Is it possibly a waste of money to even be putting bicycle infrastructure in there? Or you have to think about it as a new effective way of doing it? That's my question.
Sure. I think there's not a one-to-one comparison necessarily with those, but just in terms of your question, I don't know that a waste of money is the right framing, but I think the idea around, I think there could be ways to expand our networks by just leveraging those facilities that are lower traffic volumes, that are closer to like an LTS 2 and 3, and converting those to safer, facilities through separation, right? And so I think I would point towards the direction of using those maybe low-hanging fruit around like those LTS 2s and converting them to 1s or 3s and converting to 1. If you don't have another good, link in your network to get you from one point to the other, then maybe that LTS 4 does need to be, provided, but it's gonna have to be something substantive like a cycle track or something that really separates the cyclists from the motor vehicle traffic.
Any other questions? No. Committee members, does anyone else have any questions or comments?
Yes, I do. This is Reed.
Go ahead, Reed.
Yeah, a couple of points. The level of traffic stress was not introduced by Mercuria. It was introduced by Alex Sorton in the 1990s, and his research is readily available through TRB. He had 5 levels. He had a high and then a higher, which is exactly what we have here on I work for Maricopa County. We have a number of roads that are 2-lane rural roads with no paved shoulder. And using the methodology that first set up, we can't justify spending the money to put paved shoulders on those because the data shows no improvement.
Okay.
So we have a level 5 in our analysis so that we can go from a 5 to a 4. And if you've ever ridden on a road with no shoulder, I think you might agree that having a 5 to 6, now we'd probably put in 8-foot shoulder is a huge improvement in your stress level.
Yeah, I think that's a great point. And yeah, and so I'm familiar with the sort of level of service with cyclists or the different methodologies that historically have been there predating sort of this work. And Peter first, we use this as one that's just pretty accessible. I've used other ones that have been provided by People for Bikes and other analysis as well. And so just use this as a kind of a methodology that's out there and most people are familiar with it. But I know that, like you say, I think there is something to be gained for just having maybe more nuance in there. And I'm not necessarily, I'm in favor of this methodology, but I think there's ways that it can be improved, right?
Okay.
And so,
Yeah, that's what I'm saying.
yeah, I think that, like you're saying, that moving 5 or 4, there is something that's maybe more nuanced that's stressful
Right.
that 4 represents.
Right. Because it's still going to be 45, 50 miles an hour.
Right.
So if you can't change the speed limit, changing a sign isn't going to matter. Then you have to add some width.
There's going to have to be an acquisition, right? Yeah, exactly.
Okay, thank you.
Thank you.
Are there any other questions or comments on Dr. Gerke's presentation? Okay. Thank you, Doctor.
Thank you all.
No, thank you. We will now proceed to agenda item 6, which is the MAG Regional Active Transportation Plan update. This item is on the agenda for information and discussion and will be presented by Kay Bork, MAG Principal Planner.
Thank you, Chair, members of the Active Transportation Committee. I'm really pleased to be here to share an overview and update on the MAG Regional Active Transportation Plan. I know several of you are obviously familiar with this project, serving on the Technical Advisory Committee, but just wanted to prepare an update for members who haven't been participating and to keep you updated on the project process.
Speak louder, please.
Sorry, Grant, I will do that. Let me move the mic. Is that better? Okay.
Yeah, it sounded better.
Okay, thank you.
Yes.
Thank you, Grant. So obviously members here do know what active transportation is, but this is for those who are participating online who may not be familiar with definition of active transportation. So active transportation simply means getting from place to place using human power, and that's most commonly walking and biking. Supporting active transportation requires safe and connected infrastructure such as sidewalk networks, on-street bicycle facilities, multi-use paths, and safe and accessible crossings. Active transportation doesn't just connect people to neighborhoods and destinations. It also brings regional benefits in the form of reducing traffic congestion, improving air quality, and supporting public health by enabling physical activity. So the purpose of the MAG study is to identify active transportation needs and priorities to guide investments under the Regional Strategic Transportation Infrastructure Investment Program, or the RSTIP. The RSTIP dedicates $800 million over the next 20 years, specifically to active transportation. The active transportation update study is implementation focused, using data and analysis to evaluate system performance and prioritize projects. So this effort is structured around 4 main objectives. First, we're assessing the existing network, getting a clear picture of where our walking and biking system works well and where there are gaps. The goal here is to identify key needs and opportunities to strengthen the overall system. Second, we're identifying and prioritizing needs so we know which active transportation improvements are most critical, both regionally and locally. And the goal is to ensure that both regional and community needs are addressed. Third, we'll be recommending funding programs that direct dollars to projects with the greatest impact on safety, connectivity, and regional and community benefit. And the goal is to ensure that we're investing dollars into the greatest regional and local benefits. And finally, we'll be tracking progress through the development of a performance metric framework and public dashboard that lets MAG, member agencies, and residents see how investments are delivering results over time. The study boundary includes the MAG planning area, which also includes part of Pinal County. Key part of the study is our technical advisory group. This TAG brings together staff from several member agencies, as well as MAG staff from our safety, data, and programming divisions. And the TAG is meeting regularly to help guide the study, collaborate on public engagement, shape tasks and review deliverables, as well as providing technical expertise and local insights. So we're about 10 months into this 18th month study. We officially kicked the study off in February, where we had our first technical advisory group meeting in May. We've met at least 3 more times since then. We've wrapped up the first round of public engagement that included promoting an online and interactive comment map and survey. We did this through social media, working with member agencies, Public Information's Office, attending several pop-up events, and we'll continue to engage the public throughout the study process, both in person and virtually. A phase 1 summary report is now complete and will be posted on the project website. On the technical side, moving forward, we finished several components of the existing conditions analysis, which has been reviewed by the Technical Advisory Committee. Here we go. And then we're moving forward to the performance metrics and then ultimately wrapping up the plan in August of 2026 for regional council acceptance. This is a QR code to the project website. We'll be posting the technical memorandums after our Technical Advisory Committee has had a chance to review and comment. So I suggest tuning into that website for updates. And also I'm happy anytime if you want to email me, call me for any kind of updates or more in-depth questions, happy to help. That concludes my presentation and I'm happy to take any questions. Thank you.
Do members have any questions for Kay?
I do not see any hands raised.
I have a quick question. How just sort of in general, how was the participation from the public? Did it meet the anticipated level of input or interaction that you would hope for?
Yeah, I think the online survey and interactive comment map received a lot of activity. So that was very informative as we developed the vision and goals and objectives. So really happy with that. The pop-up events were well attended. It was maybe the timing in the year, the summertime was a little difficult to engage with the public, but we did at least 4 events in various, West, East, North, and Central Valley. So we had good participation. It did generate some traffic to the interactive map and survey, so that was great too. So yeah, more to come though.
Of course.
Mm-hmm.
Thank you, Kay. Any other questions from the committee? Okay, thank you, Kay. We will move on to agenda item 7. This is the CME AZ 2025 survey results. This item is on the agenda for information and discussion and will be presented by Maggie Wong, Interim Safety Policy Manager.
Thank you, Chair. Good afternoon, members of the committee. Happy to be here today to share some of the findings from our survey. So starting with a little bit of background, in 2019, MAG initiated the CME AZ program focused on pedestrian and bicycle safety education and enforcement. This was a strategy identified in our 2020 to 2030 Strategic Transportation Safety Plan. And this program really aimed to raise awareness of the shared responsibility for safety between pedestrians, bicyclists, and motorists, raise awareness about traffic laws regarding vulnerable road users, and also to raise awareness about behaviors that lead to pedestrian and cyclist crashes and fatalities. So really this program was meant to develop and provide regional resources for improving pedestrian and bicyclist safety in the region with 3 key goals. The first being to change people's behavior to reduce roadway incidents, to inform people about their road roles and responsibilities for safely sharing the road, and then also to increase enforcement of laws and people's awareness of that effort. So here are some examples of the social media ads that ran during the campaign. We also have a handful of videos that are still available on our website as well. The program and campaign has concluded, so today I'll be sharing final results from the survey that will help shed light on awareness and perceptions of the campaign, as well as general attitudes and behaviors of road users, which could help inform future efforts. So as part of CME AZ, we conducted online surveys to monitor changes in road user behavior and to assess the effectiveness of the program. A total of 556 surveys were completed between April 16th and May 5th of this year. The respondents were residents in Maricopa and Pinal County who were 13 years or older, and the survey was available in both English and Spanish. This survey covered a variety of topics, including road user attitudes and behaviors, as well as message recall and awareness of CME AZ. So we're going to be running through some of the key findings from this survey. Starting with location of the respondents. So we asked them what is their community of residence, and Phoenix accounted for 34% of all survey respondents, the largest share overall. The next highest concentrations came from Mesa, followed by Scottsdale, Glendale, Chandler, Gilbert, and Tempe. We have the full table there that will be provided with the slides. So moving into key highlights. Passenger vehicles continued to be the primary mode of transportation for most respondents, which aligns with the trends we saw in past surveys. Walking, taking the bus, and rideshare services all showed slight increases from the previous survey. 2/3 of respondents believe that drivers and pedestrians and cyclists share responsibility for safety. This is actually slightly down from the 2024 survey results. Although the belief that road safety is a shared responsibility was consistent across age segments, what's interesting is that 1/3 of those in the youngest age segment assigned primary liability to the driver. Additionally, most respondents believe that bike riders are allowed to ride in the travel lanes of the roadway, which is a slight increase from what they responded last year. 36% of motorcycle drivers acknowledged that they did not wear a motorcycle helmet and drove aggressively, which is a little higher than previous surveys, so something to keep an eye on. If a bike lane is not available, a majority of drivers stated that they would give the rider as much space as possible when passing. A majority of drivers also indicated that they would feel more comfortable driving on roads if there were a separate bike lane that the riders could use. And consistent with our previous survey, the two most frequently identified recommendations to improve transportation safety in the Phoenix area, this was an open-ended question, involved expanding public transportation and increasing security on and around those transit systems. And that's been consistent over the past few years, so that's interesting to note. So moving into looking more specifically at driver behavior. 1 out of 4 respondents admitted to driving while distracted. 1 out of 5 respondents also stated that they had driven aggressively or did not wear a seatbelt. These are pretty consistent with our previous survey results. 19% did not fully stop before making a right turn. This is actually lower than previous survey results. Looking at close calls, fewer than 1 out of 5 reported having a collision or near collision with a person riding a bike. Nearly a third had a close call with a pedestrian, and both of these are consistent with survey results. As a reminder, this is from the driver perspective. We'll be looking at that from the pedestrian and cyclist perspective as well. So now looking at the responses from those who chose cycling as their primary mode of transportation. So slightly less than half of these respondents reported wearing a helmet, not very often or never, which is similar to previous results. However, when we kind of shifted the wording for a different question, only 1 in 4 respondents reported always wearing a helmet. So that's down from 34% in the previous survey. 73 of respondents who ride bikes have had 1 or more close calls with a vehicle in the past year, and that has increased since the previous survey. More than half of respondents who ride bikes acknowledged not wearing a helmet, and that's also increased from the previous survey. Additionally, some other trends that we saw increase since 2024 survey are reports of riding while distracted, riding under the influence of marijuana, and riding under the influence of alcohol. So something important to note when considering cycling behavior. And so among those whose primary mode of transportation is bicycle, watching for vehicles turning right on red and riding sober were cited as activities that were most likely to increase their safety. So these have kind of increased since the past survey. Moving to pedestrian responses, 43% of respondents who identified as primarily pedestrians acknowledged not crossing at a crosswalk in the past 3 months. The next most frequently reported behaviors were not wearing visible clothing at night and not waiting for a walk signal before crossing. Slightly more than half of pedestrians reported not having any close calls with a vehicle in the past year, while 1 in 3 acknowledged having 1 to 3 close encounters. So again, the shift in wording, kind of thinking about how that affects their responses. And when we asked what action they thought would be most likely to increase pedestrian safety, being more aware of their surroundings was the #1 chosen option. Watching out for turning vehicles and using pedestrian buttons received slightly lower scores than previous surveys. And then being visible at night and walking sober received slightly higher scores compared to the last survey. So just getting them thinking about what could improve their pedestrian safety. Now moving to awareness. Similar to the previous survey, nearly half of respondents recalled messages about driving under the influence of alcohol, but the recall of distracted driving messages dropped significantly to 40%. So that's a decrease from 46% last year. And more than 1/3 of respondents actually could not recall seeing, reading, or hearing any of the message topics shared. So that's a little bit alarming. When we look a little more closely at which programs they have encountered, we asked about these specific safety-related programs throughout the region. You can see that across the board. So the blue bar on this chart shows the most recent survey in 2025, while the gray shows 2024. Pretty much across the board, there's been a decrease in awareness. So then when we asked more specifically where they saw or heard information about CME-AZ, first I want to note this is a pretty small sample size, so only 60 respondents replied to this question. So we don't want to generalize too much, but they said that their primary source was the local news, followed by social media, and then TV advertisements. And as we think about future campaigns, we also ask them just more generally, where do you go to get local information or news about topics of interest? Kind of similar to what we saw before, television through news or talk shows remains one of the primary sources of information, followed by social media, local websites, and then closely after that, search engines. So these are things that we'll consider for any future efforts. That wraps up my presentation for today. Thank you for your time, and I'm happy to take any questions.
Thank you, Maggie. Do any committee members have questions or comments? None? Thank you, Kay. Thank you, Maggie. Very interesting. Okay. We will move on to agenda item 8, which is the request for future agenda items. Are there any requests from the membership for an item on a future agenda? Hearing none, we'll go on to the next item, which is comments from the committee. Do any committee members have comments or updates that they would like to provide to the committee?
Chair.
Mr. Proch.
Hello, Mr. Sage. I was hopeful that Kay might have said, is there anyone I didn't call at roll call earlier in the conversation, but she didn't mention it, and there wasn't really a need to jump in at the time, but I was here and present and accounted for.
Thank you, Mr. Proch. Do you have any other comments?
You look lovely. Good to see you.
Any other updates from the committee? I will give an update on one of the Glendale projects that has come through the MAG committee as part of the CMAQ competitive project process. City of Glendale was awarded both design and construction funds to perform a sidewalk infill project that we refer to as the Central Core Sidewalks. It's 11, it's missing sidewalks. It addresses missing sidewalks on 11 streets in a 1 mile square area of Central Glendale. We've completed the design and we are getting ready to move to construction. So it's pretty exciting. It's been several years as that project has developed, and wanted to thank the committee for their support as we've gone through that. And I will bring an update once construction gets underway and we see how that thing proceeds. So that's all I have for now. If no other members have any comments or updates. Susan, nothing? Okay.
I can't think of any. I'll probably think of them in about 5 minutes. Thanks.
This is Reed. I do have one. For the
proceed.
last 2.5 years, we've been working on a sidewalk project on 111th Avenue from Peoria to Alabama. The road is 2 lanes, one in each direction. There were no curb cuts. The bus stop signs are in the median. It's about a 30-foot wide median. And we got a call from Phoenix Transit that said they have a gentleman in a chair that they're having to straddle both lanes and pick him up in the street because there's no way he can get up the curb onto the bus stop, which was just a sign attached to a street light pole or something. So we completely redesigned that, put in a bunch of sidewalk, a bunch of curb ramp replacements, and we finished that last month.
Well done. Thank you. Anyone else? Okay. With no other comments, we'll move on to the adjournment. The next meeting of the Active Transportation Committee will be on Tuesday, January 20th. Brace yourself, 2026 at 1 p.m. With no further business, today's meeting is adjourned. Thank you, everyone, for attending.
Thank you, Chair.
Yeah.
Thank you.